Hey guys, it's me, Doc. I want to talk to you again about the Acessa procedure. I get it. I'm kind of obsessed. It is the bomb.com for fibroid alternative treatments. So let's talk a little bit about fibroids, right? So fibroids, smooth muscle tumors. One cell got big ideas and just kept growing and growing and growing and growing and growing. And they can be the size of footballs or they can be tiny as peas. And they can be anywhere in the uterus. On the outside, on the inside, on the inner lining, in the body of the uterus. And what happens? Why do we care, right? Well, fortunately, less than 5% of the time, fibroids can be cancerous. Okay, great. That's a pretty good odds, right? As far as like, will it kill you, right? But what else can fibroids do? Oh my God, pain, pressure, can't lay on your stomach anymore, have periods that are like a floodgate opening, that are super painful and super heavy and super long. And the fibroids just keep on growing until you go through menopause and the hormone supply cuts them off, right? So I've seen fibroids that, like I said, were so tiny that they were the size of the pea, but then still making somebody half bleed to death. And then I've seen ones that were like a, good God, 5-6 month pregnancy in a patient who, again, miserable, anemic, pelvic pressure, heavy bleeding, constantly wiped out, right? So back in the day, the solutions were not great for fibroids, right? You could try doing an ablation, which is, putting heated fluid inside the uterus to scar down the lining to hopefully make periods stop. But I'm going to tell you right now that doesn't work well for fibroids, right? And then we had uterine artery embolization. So you go into the interventional radiology suite and we put these little particles literally into the veins by the uterine arteries to try and cut off the blood supply of the fibroids. And then afterwards you feel sick, you have a fever, you get kind of like a post blood clot syndrome, feel like crap, you have pain because the fibroids begin necrosing and shrinking. Not great, and a big chance of retreatment. And then there was the good old hysterectomy, right? Sometimes you could try and shrink the fibroids first by using chemicals and injections and Lupron and things that threw you into a chemical menopause. You had all the side effects, the bone loss, the hot flashes, the dryness, the feeling like crap, the feeling like menopause before you're actually in menopause, hoping that they were going to shrink down enough that you could do a hysterectomy that wasn't a hip-to-hip incision, right? Well, you know what? It's all different now. Now we have the Acessa procedure. Let's talk about that for a second. So I just had a patient the other day. We did an Acessa procedure. Big, huge fibroids. Never had any babies. Little narrow vagina, right? And she would be one that would end up with a big old abdominal incision because just nothing was going to fit out anywhere, even with the robot, right? Didn't want to tolerate the symptoms of the Lupron or all the side effects or the other medications that are out there, right? And really had never had a major surgery. So was she too fond of the thought of having a big old incision? No, I don't blame her. And thank goodness the Acessa availability came my way, right? So I got trained and I did my demos and I did my cases and I found out all about Acessa and offered it to this patient. So what is Acessa? So Acessa is a procedure by the Hologic Corporation that involves laparoscopy and ultrasound and radiofrequency ablation. Okay, so what does that mean, right? So this is an outpatient procedure, okay, where you are completely put to sleep, general anesthesia, tube down your throat, the whole 9 yards, right? And we put a non-metal manipulator in the uterus to be able to move it around from below. And then we make an incision in the belly button and put a camera in there. First thing we do is we look around the pelvis, kind of get the whole lay of the land. Where are the fibroids? What else is going on in the pelvis? Are there adhesions? Are there anything else, right? And then midway between the belly button And right about at the top of where we palpate the big fibroids to be, because sometimes these fibroids are so big we can palpate them through the abdomen, right? We put a second, little bit bigger incision to put our ultrasound probe in. Then I have an ultrasound while I'm watching with the camera, and I can map out where all the fibroids are with precision, okay? And then the last component is we have this little super sharp, it's almost like a little spear that we're going to use to deploy the radio frequency energy, right? So while I'm watching with the ultrasound, we're putting that spear into the fibroid while looking through the camera also, okay? And then we can see on the ultrasound screen and take measurements of just how deep we need to go. Then what happens is that spear, I do what's called a deployment. So it opens up like claws, okay? And then all the physics are pre-calculated with exactly how much we need to ablate and exactly what what's called the array is, how far out the radio frequency ablation is, and you can literally watch the fibroid be ablated on the screen. So like the other day, my patient had huge fibroid, right? And we treated the whole darn thing. So what happens when we treat a fibroid, right? How fast does it happen? Well, changes start happening almost immediately, with the end up goal of the fibroid being, instead of like a hard ball, like a mushy marshmallow. And we get not only total volume decrease, but also bulk decrease, okay? So you start getting some of the effects of that reduce in bulk pretty fast. Like in 3 months, you're going to notice something significant, and then again in 6, and then again in a year. And we can get over 50% volume reduction. I mean, this is huge. And volume is not the same as actual size, by the way. So the difference in like the pressure symptoms and the bleeding and the pain and the bloating and all that are huge. Now, I looked at statistics before starting to do this procedure, right? And actually, they're pretty good. We talked about huge volume reductions, and also they looked at, who needed to be retreated in 3 years, and it was only like 8%. That's pretty great. That's something I'm willing to take a chance on. And instead of all the downtime from hysterectomy, just a couple little laparoscopic incisions and home you go and wait for the good stuff. Sounds pretty good to me. So if you're having fibroids and you're getting a lot of pressure about having a hysterectomy, come see me. We can talk about some alternatives. Now, let me make one thing incredibly clear, though, right? So it is absolutely essential whenever you're having any abnormal bleeding or heaviness or pain or whatever to get your workup first. You got to make sure there's no precancerous or cancerous tissue in there before we entertain these alternative options. So that means sometimes DNC, hysteroscopy, and endometrial biopsy, you've got to get a tissue sample first. That's just a minimum requirement. I would also suggest, too, that if you chose to go with the Acessa procedure to ablate the fibroids, that you consider combining that with an ablation for the inner lining also, so that maybe we could stop everything altogether. Now, they're also looking at Acessa for patients that are still in their fertility period, trying to decrease fibroids, because we don't disrupt the lining with that, to increase their chances of getting pregnant. So that is also a possible option as far as the Acessa procedure. So if you have any questions, give us a call. Our number is 734-242-5588, and I would love to talk to you about this wonderful, wonderful alternative. Have a great day, guys.